let's take a look at our client population. Our client today is a baby boomer who has recently experienced a stroke. Therefore, we will begin by taking a look at some of the characteristics and challenges experienced by the baby boomer generation today. Baby boomers were born following World War II from 1945 to 1964. They have seen many changes throughout their lifetime. They are noted for valuing personal and professional relationships, with many considering their job as a defining characteristic and a part of their identity. Today in 2023, baby boomers are anywhere between 59 to 78 years old. Many of the individuals in this generation are in a life stage that includes many transitions. They are going from parents and workers to grandparents and retirees. There are some concerns that are common among many in the baby boomer generation. One of these concerns is finances. According to a survey done by the Pew Research Institute, 55% of baby boomers say that it is likely that their income will not keep up with the cost of living over the next year. This financial insecurity can lead to stress, which can exacerbate existing health problems or create new health problems. Speaking of health, another concern common to boomers is declining health. Baby boomers are facing more health problems now compared to when they were younger. Some of the health issues that they encounter include cancer, hearing loss, and vision loss. There are also cardiovascular issues that can arise in your 60s, such as heart attack, stroke, and rising blood pressure. Not only that, but problems such as weak muscles, achy joints, decreased sleep quality as your body produces less melatonin, and bladder control issues can decrease their quality of life. One last issue common to baby boomers is social isolation. Many baby boomers, as they go through this life stage full of transition, find themselves unexpectedly alone due to the death of a spouse or partner, separation from friends, retirement, loss of mobility, and loss of transportation. Research has linked social isolation and loneliness to a higher risk for a variety of physical and mental health problems. Now that we have looked at some of the challenges that baby boomers face, let's look at how they approach spirituality. Many in the baby boomer generation, known for ushering in an era of protest that brought about transformative change in American society, are increasingly turning to churches, temples, and mosques to find meaning in their later years of life. This is the major finding from the latest wave of data collected from the longitudinal study of generations, which was originally developed in 1970 at USC by Professor Vern Bankston. According to Bankston's study, many people become more engaged in religion and more involved in religious activities as they approach the end of life. There are several reasons that may have caused this trend. The first reason is practical. People simply have more time in their retirement and are not preoccupied by full-time work. The other reasons are more personal. An example is the growing sense of impermanence that comes with age. People become more aware of the shortness of years remaining in their life. Many of them want to set their house in order, so to speak, at the end of life. The third reason is connected to this awareness. It is the direct experience of the fragility of life. Many people experience a health crisis that actually brings them closer to death. It causes them to reassess what is truly important and what is much less important.
This quote says that anything can become a spiritual practice once you are willing to approach it in that way. Once you let it bring you to your knees and show you what is real, including who you really are, who other people are, and how near God can be when you have lost your way. What I like about this quote is that it says any activity can be spiritual, so it is subjective to each one of our patients. And as therapists, it is our job to understand what they find meaningful to somehow incorporate that into our plan of care.
Now we will look at cerebrovascular accidents, or CVAs, also known as strokes. This is the condition that our patient has experienced, and we will review this so that we can understand the impact that the stroke may have had and the deficits it may have caused. According to Pedretti, the outcome of a stroke depends on which blood vessels were involved. Some common deficits following a stroke include hemiplegia, which is complete paralysis on one side, hemiparesis, weakness on one side, visual field impairment, lack of judgment, perseveration, impaired organization or behavior, depression, emotional volatility, body or visual neglect on one side, challenges with speech or comprehension, and memory impairment. Typically, a client's clinical findings immediately after a stroke, which is the acute stage, represents the worst-case scenario. In other words, once the stroke is complete and the client is medically stabilized, barring any further complications, the client is at his or her worst. Fortunately, the client is usually expected to improve from both a neurological and functional perspective. Unfortunately, predicting the amount of improvement and the length of time necessary for improvement to take place is difficult. Clinicians generally agree that the first 3 to 6 months following a stroke is the most crucial time, and the greatest improvements take place during this period. It is important to note that some patients may only recover slightly and slowly, whereas others may recover fully.
As occupational therapy students, we often discuss the importance of addressing spirituality with our patients as a part of the holistic approach. Even though all healthcare professionals should be able to address spiritual needs with their patients, we as OTs may be the most likely to address these needs. And this is because spirituality and engagement in occupations are often related. And we know that facilitating occupational engagement and maximizing occupational performance are often our main concerns as OTs. According to the American Occupational Therapy Association, spirituality can be considered foundational to providing occupational therapy services. Spirituality affects how we think, feel, and behave as occupational beings. Spirituality is often tied to religion, but not always. Some people connect with a higher power that is not related to a particular religion. And as Allison mentioned earlier, people can find meaning and significance in different ways, including spending time in nature, participating in community activities, and spending time with loved ones. It's also important to remember that as occupational therapists, we are very likely to encounter patients who are experiencing hardships. Addressing spirituality is crucial because it can provide great comfort and support in difficult times, such as when dealing with loss and grief. I think that by now we all know the importance of addressing spirituality with our patients. But research has shown that most healthcare professionals, including OTs, rarely discuss spiritual needs with their patients. There may be many reasons why this is the case, but the main explanation is that practitioners often don't feel equipped to address issues related to spirituality. And in addition, they may not have a good understanding of what spirituality means. Therefore, to be able to address spirituality, we first need to develop a good understanding ourselves. Then we need to explore different ways to address spirituality with our patients. Even though we can gather spiritual information when completing the occupational profile or just by having conversations with our patients, we may sometimes need some additional guidance for how to bring up the topic. And one tool is called the HOPE questionnaire. So the HOPE questionnaire was developed to help health practitioners better understand each patient's unique needs, including their spiritual needs. We will encounter patients from different backgrounds and cultures, and we may not be familiar with certain religious practices or rituals. And since spirituality is often connected to religion, it's important to understand different practices, especially when designing our intervention plan and building rapport with our clients. By maintaining openness and curiosity, we can also ensure cultural and religious sensitivity. I will now go over some of the questions in the HOPE questionnaire. We may discuss all of the components or only a few depending on the client. H represents sources of hope. We could ask, what are your sources of hope, strength, and comfort? O represents organized religion. We could ask, do you consider yourself part of an organized religion? P represents spirituality or practice. We could ask, what aspects of spirituality or spiritual practice do you find the most helpful? For this question, we may need to clarify what spirituality is. Some patient may say they're not spiritual or they do not belong to any religion, and that discussing spirituality is not important. In that case, we could use a more explicit definition of spirituality, such as spirituality can be defined as the experience of meaning in everyday life. And lastly, E represents effects on medical care or end-of-life issues. We could ask, are there any specific practices or restrictions I should know about in providing you with care and services? Information gathered using the HOPE questionnaire can help us get a better understanding of the client's values, beliefs, and spiritual needs, and it will help us set meaningful goals. It also helps the occupational therapist choose appropriate treatment while also respecting client's background and culture.
So now that we've gone over the population that we are working with and that we're going to address and talking a little bit about spirituality, let's talk about the first part of the OT process in which we get to know the patient. We'll be using an occupational profile, which is an evaluation tool that is an interview-based structure where you get to talk to the patient, ask them certain questions about their lifestyles, habits, roles, routines, get to ask them what their concerns are. This is also a great chance for us to ask about spirituality and how they define spirituality. And so we want to make sure that we are non-assumptive and really just getting to ask those simple questions to get to know the patient more, being culturally competent as well, making sure that we are sensitive to how they do things, and really just getting to know how they do every part of the occupations that we're trying to identify. And so we'll be using the occupational profile, and the following is what we've found. To go a little bit more into detail about the evaluation methods we use occupational profile, the COPM, and the HOPE questionnaire. And this is just a great way to see how we conducted that. It's semi-structured, as I said before. And something to note is that when we started to interview our patient, he was at first distraught. He was very sad about his condition, about how the condition affected his arms, his range of motion, and just his overall affect. And so, but one part of the occupation profile does talk about his about asking about spirituality. And once we got into more conversation about that, his disposition changed. You can see right now in that video, he's lighting up right now. He really likes talking about his faith, and just in the way an OT can approach this with sensitivity and just asking the right questions can be the real turning point in acquiring that level of rapport with your patient and getting that much more information, which obviously ultimately contributes to how OTs can develop their treatment plan to make it more individualized and much more targeted to those skills that can really help them participate in the occupations that they want. And so, in addition to acquiring his interests, his concerns, his routine at home, his support system, all that's interweaved with spirituality. And so it can be really beneficial to ask those questions and make sure that you're not assumptive and really getting to understand where your patient is coming from. Just like Sunniva pointed out, for the HOPE questionnaire, we found out so much with that tool as well. Really got to know why or where he likes to go. He mentions about his, a place where he and his wife used to go to, and that can be definitely used in interventions. And we also use the COPM, which is the Canadian Occupational Performance Measure, which is a really great tool if you want to get more into detail about specific occupations, as it goes over 3 realms of self-care, productivity, and leisure. And that's where we got to find out that he really prioritizes spending time with his family, especially his granddaughters. And there can be a lot of things that a person spends time with leisure, but the COPM really does a really good job of providing like a hierarchy of what's really important, as there could be so many things we could address, but we want to make sure that we address the really important ones as it attains to their self-care, productivity, and leisure. As occupational therapists, we are trained to know conditions such as stroke. We know that it is a neurological condition that can affect one's range of motion, spasticity, and even cognitive abilities. And so during the evaluation, it's important for us as occupational therapists to kind of identify these things as we're asking questions of to our patient. How are they sitting? How are they responding? And at the pace of what they're responding. These are kind of things we can already see before we do formal assessments such as assessing their range of motion, as seen in this video. We want to make sure we get a good assessment of how our patients can move against gravity and without resistance. And so this video just shows a little bit about that. And keep in tune as we provide you with our findings after having done the occupational profile, the COPM, the HOPE questionnaire, and the range of motion assessment. Going to be discussed by Kayla soon.
Meet Steve. Steve is a baby boomer. He is 70 years old. He recently had a stroke and has since been working with an occupational therapist to regain his independence in his occupations. Steve has 3 granddaughters, 2 children, 1 daughter and 1 son, 1 wife who has passed away. The main goal that he will be working with his occupational therapist will be increased participation in leisure exploration. Steve's prior level of function was full independence in his occupations. He spent much of his time playing with his grandkids, spending time in nature, golfing, going to church, but since his stroke, he has not been able to get back to his regular routine. After his stroke, he has not been able to go golfing, gardening, spend time in nature, and his lack of spiritual activity has negatively affected his mental health. He reports he cannot lift his hands during worship like he used to. Steve's interests are golfing, yoga, spending time with his loved ones, and worshiping at church. Steve's current symptoms include spasticity, left field neglect, balance issues, limited range of motion, cognition, slurred speech, hemiplegia, mobility, and subluxation.
This quote says, "Understanding people as occupational beings highlights patterns of meaningful activity woven within their lives to create and sustain health and well-being. As future occupational therapists, we understand the value of being able to participate in meaningful activities and the impact it has on our clients' well-being and quality of life. We use a holistic lens to examine intrinsic and extrinsic factors that may be preventing or hindering our clients' performance within these activities. These are our strategies to incorporate spirituality into treatment. Practicing compassionate presence, so being fully present and attentive to our patients and supportive of their needs. Spending time in nature. Incorporating meaningful activities into treatment. For Steve, this would be golf, household tasks, and being able to raise his arms up for worship. And also following religious customs, so prayer or going to religious services.
Meaning is constructed through our relationships with ourselves, other humans, other inhabitants of Earth, the Earth itself, and for many individuals, a higher power or creator. We live out this meaning and our relationships through doing or occupation. However, when an occupation is interrupted to the extent that the relationship is affected, the activities involved will lose their meaning, and the will to participate in the occupation will suffer. Consideration of spirituality is essential in assisting the client to engage or re-engage in occupation. Since Steve's stroke, he has not wanted to participate in his favorite activities and has felt not only disconnected from his family and friends, but God as well. The overall goal of his intervention program is to regain his connection to spirituality and independently perform ADLs, IADLs, and leisure tasks. Since Steve has spasticity, we wanted to implement some preparatory activities to help increase the range of motion in his affected left upper extremity before completing our occupation-based activities. In the video on the right, you can see that an occupational therapist is utilizing the contract, relax, stretching technique, which is a form of PNF. PNF stands for proprioceptive neuromuscular facilitation, and this technique allows Steve to stretch his bicep, which is currently tight because of the spasticity. He would isometrically contract the triceps, which is opposite from the biceps, for about 10 seconds. Then he would relax his tricep to further stretch his biceps by straightening the arm with some assistance. The occupational therapist would repeat this process until Steve's arm is relaxed and fully extended. After completing the contract, relax, stretching technique, we would move on to running through the D1 flexion pattern, which is also a part of PNF. This movement promotes motor learning, strength, range of motion, and endurance. It also targets muscle groups, movement range within a total movement pattern. During this movement pattern, it is important to have Steve visually look at his arm and twist his trunk along with the movement for best results. Once I'm able to get him to move through the pattern effectively, I would add resistance to make it more challenging, which would help improve his ability to initiate movement. It would also improve his postural control, stability, and balance, which would help him get back to doing the activities he loves, like golfing. Once Steve mastered the D1 flexion pattern inside the clinic, we decided to bring him outside to start practicing the same pattern while swinging a golf club. Being outside on the grass is beneficial for treatment because it simulates being on a real golf course. In addition, being in nature can evoke feelings of spirituality. Steve really wants to get back to golfing as soon as possible because most of his friends golf and he misses spending time with them. Also, he stated that being outside in nature is therapeutic. He used to golf every Friday morning at his local country club, but has been too embarrassed to return since having a stroke. This occupation-based activity is helpful because it incorporates both arms so his non-affected can assist his affected side. It also increases range of motion, coordination, and strength. During the next few sessions, he will work on making a full swing independently and then starting to hit some golf balls.
If you can recall, one of Steve's primary goals is actually a spiritual one, to be able to raise his arms up over his head at church for worship. You may be wondering, what occupation would this goal be considered anyway? Because as occupational therapists, we don't get paid unless we work on something occupation-based. Well, in our OTPF, our Occupational Therapy Practice Framework, the book that tells us everything we can and can't do, under IADLs, so Instrumental Activities of Daily Living, these activities are activities that support daily life within the home or community. Listed as an occupation is religious and spiritual expression. In this next treatment session, I want to continue to regulate the tone in Steve's affected arm. Since he presents with increased tone and is always in a flex position with his elbow bent, I want to activate his tricep muscles to counteract the force of his biceps. So, as a preparatory activity, I am applying some tapping on his tricep muscles to stimulate them to contract. Therefore, this helps try to break him out of that flex position.
For an intervention activity, we had Steve participate in seated yoga outside. Ultimately, we want to increase the range of motion in his affected arm. Using the Roots approach, tapping may be used to help stimulate muscle activity. Yoga allows Steve to stretch his upper extremities while having his unaffected arm assist in the stretching. As the practice of mindfulness is an integral part of yoga, people who practice yoga often report feelings of peace and relaxation. Yoga also works on deep breathing, which helps to relax the body and mind to reduce pain, stress, and anxiety. Yoga may be a spiritual practice for many people because it may help to deepen the connection between mind, body, and spirit. We also will be using NDT techniques to decrease spasticity in Steve's affected arm. Since he wants to be able to do household tasks independently, our activity will involve him weight bearing on his affected arm. He will first start with a closed chain, meaning his affected arm will remain still while applying his body weight on it. Then, as he progresses in treatment, he will use a modified chain, moving his affected arm while still weight-bearing on the table.
Caregiver education is important to optimize the effectiveness of therapy interventions and ensure the well-being of individuals receiving care. Caregivers are essential partners in the rehab process because they provide invaluable support and assistance to individuals with cognitive, physical, and emotional challenges. By offering caregiver education to Steve's daughters, they will be well equipped with the necessary knowledge and skills to manage and facilitate his daily activities, routines, and exercises that contribute to his recovery and improved quality of life. The occupational therapist provided instructions on proper body mechanics, energy conservation strategies, techniques for transfers and mobility, adaptive equipment usage, and strategies for incorporating more spirituality into his everyday life. The therapist provided Steve's daughters with an example of how to assist him by providing just the right challenge while he reads his Bible each morning. Lastly, the occupational therapist told his daughters that she is going to refer their father to continue outpatient services to improve range of motion, to be more independent in ADLs, IEDLs, and leisure tasks, and physical therapy to improve his gait.
In continuation of the discharge plan we have for Steve, we also included the home exercise program. We gave him a printout of how each exercise is to be executed, as well as some pictures so that he can get some reminders on visualization to kind of help with his cognitive deficits and to help stimulate his memory. And this is overall contributing to increasing his range of motion so that he can participate in his meaningful occupation of lifting his hands in worship. And so these exercises are meant to help challenge that, and especially targeting those shoulders so that he can go and lift them up, as well as opening up the hands and the forearm from the bicep. And so we also recommended the walker, as it will help his mobility around the house. It'll help his mobility to public places that he finds meaningful and spiritual, such as the park that we mentioned, that is where he went with his wife often when she was alive. And so this will really help him get more engaged with the spiritual practices that he was very passionate about early on, and when we were talking about the occupational profile, getting to know him through the COPM and the HOPE questionnaire.